The muscles that are involved in maintaining the stability of the hip joint as well as supporting the body while standing and walking include that of the iliopsoas. And so the iliopsoas is going to be the conversion of the iliacus muscle, which, as you can imagine, is going to be found within the ilium of the os coxae, and then the psoas major, which is this large muscle here that extends from the vertebrae, and together they are going to then attach at the lesser trochanter of the femur. So where they converge here at that lesser trochanter, this is going to be the iliopsoas muscle, and they work together in order to flex the thigh. The sartorius is going to be a long, thin muscle that is going to cross over the anterior thigh and help with flexion of the thigh. This muscle is also the longest muscle within the body. In the medial compartment of the thigh, there are 6 muscles that are responsible for adducting the thigh, flexing the thigh, and also for lateral rotation. So the adductor longus muscle and the adductor brevis muscle are going to be more anterior, and they are going to lie in front of the adductor magnus muscle, which is more posterior and is going to be this long sheet of muscle. The gracilis is going to be the most medial muscle that we find of the adductors. And the pectineus muscle will be a deep muscle. All of these muscles are responsible for flexing the thigh. On the posterior side, we have the gluteus maximus. And this is the largest of the gluteal muscles and one of the largest muscles in the body, also known as your glutes. And this is the chief extensor of the thigh and laterally rotation of the thigh. And deep to the gluteus maximus, we have the gluteus medius, which is a powerful abductor of the thigh. And this also is involved in medial rotation of the thigh. So when you have intermuscular injections, these are often given in this gluteus medius muscle. On the lateral side and on the superior side, what we have is a single muscle called the tensor fasciae latae, and this is a muscle responsible for abducting and medial rotation of the thigh. Now, this also is going to be attached to this thick band here, and this is your IT band, or your iliotibial tract, that's going to extend all the way from the iliac crest to the lateral condyle of the tibia. The hamstrings are a set of 3 muscles that are found on the posterior compartment that are responsible for extension of the thigh, but then flexion of the leg. The biceps femoris is going to be the muscle that we find on the lateral side of the leg. And it's going to be a 2-headed muscle that can laterally rotate the leg when the leg is flexed. The semi-membrane osseous is going to be the muscle that is going to be deep to the semi-tendinosus. And so both of these muscles we will find on the medial side, where they also are responsible for medial rotation of the leg when that leg is flexed. On the anterior side of the thigh are a set of 4 muscles that are very large, and these are known as the Quadriceps Femoris. And these are some of the most powerful muscles in the body. What we have here first is this Rectus Femoris. This will be the superficial most muscles of the quadricep, and this is on the anterior side that is going to proximally attach to the os coxae here, and it allows for flexion of the thigh. The vastus lateralis is going to be on the lateral side of the thigh and will also be anterior. Part of it will be covered though by the rectus femoris. Then we have the vastus medialis, which is now on the medial side of the thigh, and part of it too will be covered by the rectus femoris. And lastly, the muscle that we can't see is directly covered by this rectus femoris. And so that will be the vastus intermedius. And this is going to be, again, deep to the rectus femoris, where all four of these muscles function as to extension of the knee.